My name is Alicia Downs. I am the Director of Patient Care and Education at Integrated Diabetes Services. And I was asked by the folks here at DMB to do a live stream with you guys. Pardon me if I'm not looking straight at the camera. It's at a funky angle that I'm not used to. Zoom has kind of trained us all to look kind of up and to the side a little bit, and I have to look down to connect with the camera here. So I'm going to be going over some info for you guys on technology and diabetes management, specifically CGM and pump therapies. I'm going to stick today to our FDA approved technologies. These are available, they're all covered on Medicare now. Almost all the CGMs, there are a couple that aren't, and most private insurances as well as Medicaid now. They all have different things that they have to require to get through, a lot of hoops you have to jump through. So I'm going to go over what they are, how they work, what they look like. And then I'll give everyone a chance to ask questions. Hi, everybody. As we're gonna do some questions at the end, you can type in your questions, and I'll field those as best I can. While we're letting folks jump in and get warmed up, I'll let you know a little bit about what we do at IDS, Integrated Diabetes Services. We are a practice of diabetes care and education specialists. That's what your CDE is now called. Diabetes care and education specialist. DCES. DCD. But we all of us at IDS live with type 1. We all use insulin and insulin delivering technologies. We all use CGM. So we're doing our best to walk the walk while we talk the talk. That said, when we get around to looking at one of our pumps tonight, you'll be looking at mine. And it's been kind of a rough day in my diabetes world. But that means our education is real world. We are zero judgment because we live life with type 1. We know that it's not all just about getting the math right. There's a lot of pieces to this puzzle. So let's dive in on our tech, because that's what you guys are here to see today. I'm going to start with CGMs. We have 4 FDA-approved CGM available. CGM stands for Continuous Glucose Monitor. And whichever brand you're looking at, what CGM does is it, by one way or another, implants some form of a sensor just under the skin. That sensor uses a few different methods to analyze the glucose level in what's called the interstitial fluid. That's the intracellular fluid in your fat layer. And then sends that information to a transmitter that then transmits to some form of receiver device. So we'll start with the kind of least common and least known about, I think, probably sensor.